meaningful dialogue with individuals that take care of patients. Okay, that's physicians and nurse practitioners and nurses and technicians, and figure out how we solve that problem with those individuals that deliver that care. I've been doing this now for 27 years. I've never had one patient wake up and say, gee, I don't feel well, better go see my hospital administrator. Okay, it doesn't happen. What happens is doctors and nurses take care of folks. And what we need to realize is that the insurers, the leaders of the insurers, the two health systems in this community, our elected officials, and the business owners need to come together and figure out how we solve it for our community and how we fund it for our community. And if there's a health system at the table, the other health system ought to be at the table. Whether it's a small free clinic in Dilworth, a medical school, or building comprehensive cancer services, they ought to be integrated together, truly, because the individuals that are going through these diseases, whether they can afford to pay or not, doesn't care who's taking care of them. They want to know that they're being taken care of. So we need to look at it being a new day, not being so, forgive me for saying this, competitive in Charlotte, more collaborative, but we need business leaders. We see banks working together on things all the time. We need a health system, and we need help with business leaders that have pulled it off in other sectors, and we need referees and coaches from the elected officials to tell us what we can and cannot do. But I do believe we've got the intelligence in this community to be a benchmark community on how to deliver comprehensive primary specialty care for an entire community that the rest of the nation could learn from.
Yeah.
A couple of things. I mean, certainly Blue Cross has supported some of this to a large extent. We've certainly worked with the North Carolina Association of Free Clinics. We've put a lot of time and effort in that over time. I think as we do, so one of the questions that Mark brought up for me is we need to be collaborative. I agree. The approach has got to be collaborative. On what, but this is a free enterprise system. This is an entrepreneurial system. On what basis will we compete? And I would suggest that transparency around performance and outcomes is where we need to be competing. We need to be collaborating on communication, on access, on control and cost, but how well do you do the job? We established, I did this many years ago with bariatric surgery, but we've now moved on to orthopedic surgery, cardiac surgery. You know, who does the best job? For the best price? We're now using a software system now that helps us analyze not only what proportion of the total cost was a potentially avoidable complication, what part was typical cost, typical care, and what was the total cost. And employers are very interested in that kind of information because you're right, at one level people don't care until they get the bill. And if they have the opportunity to look prospectively, they will choose a place that has higher quality at a lower cost. And the Medicare data now is beginning to show that, you know, I used to argue, and I had done some studies 20 years ago or so with physicians, is that you cannot positively correlate cost and quality. I did a study looking at the quality score and the cost score, and it looked like a shotgun. There was no correlation. Medicare data now in the hospital setting shows that there's a negative correlation between cost and quality. Not always the case, but on average. And why? It's because of redundancy, waste, and inefficiency. But how do patients know who to pick? We need to do a better job. And again, the Hospital Association has been working on this for some time, but we need to be able to get side-by-side comparisons. And for that matter, how do we perform with one ethnic origin versus another? That's a level of sophistication we don't have at this point. That's exactly where we need to get.
Help me, Russ. Now for my knee replacement, I need to go solicit bids.
You could, I suppose.
Okay.
You could, I suppose, but I would just, go to our, hit the knee center at Mercy Hospital if I was you.
So let me comment on that. We have the opportunity from North Carolina, and I'm sure everyone's heard of medical tourism. Most folks down here will remember the Lowe's deal with the Cleveland Clinic around elective cardiac procedures. North Carolina can be a destination state, or it can be a point of departure. And there is no reason, given the healthcare providers we have in this state, that this cannot be a destination state for domestic medical tourism.
Okay.
And I would agree with that. What I would tell you is that regardless of what your ailment is, you ought to have a genuine, authentic, personal relationship with your care provider, and where he or she feels you will get the best care. So, since we've already thrown it out there to say there's only one orthopedic hospital in the area, and by the way, it's the top-rated orthopedic hospital in the country.
We have a question.
I'm very new to the Charlotte area, and I'm starting to get the distinct impression that there's a lot of competition.
I wanted you to be better.
So my question is, as a consumer, we have a tremendous access to information today via the internet or social networks and such. How are you shifting your marketing, your patient outreach to address that, and if so, how? Because as a consumer, I do a lot of research when I'm looking for a doctor or a facility. I reach out to my network. So I'm curious what your positions are on that.
I think you're in the population that is growing. Traditionally, most people have gotten their provider through word of mouth, through a neighbor, through a friend, through a coworker, through a healthcare employee. More and more people now will go to the internet. They will, if you go to our website and find a physician, that website and what it will tell you about that physician is so much more information than a physician ever thought they would put up on a website. You know, in terms of not only where they went to school, what their specialty is, what their subspecialties are. It will tell you what their interests are. It will tell you, you know, what kind of, subspecialties that they might be especially interested in. So there's a lot more information today available on a website than there ever was before. But I think until you have a chance to look at those things and see which of those is most important to you, you're not going to be able to decide who who the best person is for you. But a lot more information is made available today than there ever was before.
Shifting gears a little bit as we wrap this up, we've talked about the quality of the healthcare in this region, and without a doubt, we have very strong service providers. We have a very strong statewide insurance company here. We have very strong research and research capacity emerging here in the Charlotte region, and very strong on the eastern side or the northeastern side of the state. But how does this region rank nationally in terms of our healthcare slash life sciences infrastructure, and what's missing, and what should we in the economic development community be focusing on in an effort to continue to build this critical mass and continue to take advantage of the opportunity for quality job in this sector in the Charlotte region? I'll start with you.
So, I work for the David H. Murdoch Research Institute. How many of you have heard of DHMRI? Okay, well, it's a good educated audience here. DHMRI is the nonprofit arm of what's going on campus, and we were originally founded to be kind of what Mr. Murdoch called a core lab. We have a bunch of really cool toys for people to play with and do some great science with. Over time, since our opening 2 years ago, we have really grown into a real hotspot of expertise. I'll give you an example. We have a 950 megahertz NMR. It's a big, big magnet. It can do some really in-depth imaging of molecular interactions in proteins and small molecules. An NMR is kind of useless if you don't have the people who know how to use it. And so over time, DHMRI, as well as the rest of the campus, has really built up this center of knowledge and this group of people who really can take the tools that we have and apply them for real-life situations and real-life research. One of the things I think that's missing and that all of you can help us with is not just looking at the research campus, but looking at the region as a whole, is awareness. I'll give you an example of my own story. I'm a scientist by training. I moved here, and I was a trailing spouse, and so I yelled at my husband because I had no job, and started looking around and found this great campus and all the great things that are going on there. Got myself plugged in and have been there for 3.5 years. In my intro, Ronnie mentioned BioConnect. This is a group that I helped create. I'm a very outgoing scientist. I could talk to a wall or any stranger I meet. A majority of the people who I meet who have my background and training are not like me. So when it comes to networking, to really going out there, meeting people, not just meeting people, but forming collaborations and working together, it's very difficult for the life science and biotech community to have these opportunities. And so we created BioConnect as really a networking tool. But what we've found, and we've been in existence 3 years now, is that in the region there's still a very big lack of awareness for the growing strength of life sciences. I meet people on a daily basis who've never heard of this campus, and it is amazing to me because I've seen it on the front page of the Charlotte Observer. So I really think more than anything, seeing the campus, seeing Charlotte as a growing biotechnology hub is very, very important to the success of this community really taking off here and becoming a driving economic force. Research and development really affects the economy, and we know that. We read the statistics. I have a statistic here. Currently, North Carolina is third in the nation for biotech. We have an organization in the state called the North Carolina Biotech Center that does nothing but really promote and foster biotechnology growth in the state. There is no such body in the national government, so it's very hard to get statistics. But right now, we have 500 biotech companies in this state with over $12.5 billion of revenue. So, you take a piece, you look at that and you think, wow, this could really have an impact. But it's really up to all of us to spread the word. And as a closing, I want to invite any of you who have not been out to our campus to definitely find us, give us a call, because we'd love to show you and kind of share with you what we're doing out there. It's a pretty amazing site.
Thank you. John?
I think North Carolina, if I was a business looking at North Carolina, there's no doubt that we have superior infrastructure to a number of places, whether it's the research institutions. Frankly, the highways are better than most. I've done my training in Pennsylvania. We've got really smart people. We've got really way more than our fair share of great academic institutions, among which I would include UNC Charlotte, or Charlotte University, excuse me. But I would also point out the disconnects. We have one of the highest infant mortality rates in the country. We have one of the highest obesity rates in the country. We have a higher smoking rate than many places. Those are all medical conditions. Now, lest anyone feel that I'm blaming the provider community on that, we're probably a piece of it, but this is as much a social issue, and this is where all of us as business people have to help work on these issues. Again, smoking was not defeated, the prevalence of smoking was not defeated by a medical discovery. That was a social program. Seatbelts was a social program. So we're going to need to attack the issues of particularly obesity, probably depression, along the same line. So again, good news, bad news, but if I was someone looking to start a business, North Carolina would be a great place to do it.
Mark?
I think as we go forward, we need to take a look and learn from some communities that are like ours that have evolved perhaps ahead of us in many ways. And we're going to stick to the subject of healthcare and soon it be an economic engine going forward. But I take a look at it and, you know, we have two world-class healthcare organizations, despite, you know, where you go to get your meeting place. We have two great healthcare organizations. No dispute in that. We have the greatest community college in this country. Okay? We have some of the highest universities and individuals pursuing education in those universities that are seeking allied health, nursing, biotech, whatever the case might be that we'll use in our industry. What I'll tell you, what saddens me, is that we're the 19th largest city in the United States and the largest without a comprehensive four-year medical school. And what I'll tell you, when I read things like Campbell University in Bowie's Creek, North Carolina, saying they're going to have a medical school in 5 years, it troubles me. And I understand and hats off and applaud my colleagues at Carolina's Health System for working with UNC. My blood is Carolina blue. I want you to know that. But I say we're ready for a four-year medical school now. We need to start planning that now. And we need individuals. I see Tony. I didn't see you, and I gave you. We need Tony at the table telling us how many allied health professionals can you train to support a $3 to $10 billion economic engine that a four-year medical school will bring to this community. We need all of the universities there. We need both health systems, physicians from both health systems, and the business leaders. We ought not be the 19th largest city in this country, number one, probably in the free world without a medical school, and not have a comprehensive plan that in 5 years we have a four-year medical school. And regardless of what's said on either side at the state level, both healthcare organizations are providing residency training for primary care physicians today. They're rotating through both systems. And I know together in 5 years we can bring it to this community. And finally, I'll tell you what I'm pretty good at. As a guy who's been doing the administrative side of healthcare, I can tell you what the hurdle rate needs to be to build a new hospital, return on investment to buy a CT scanner. What I can't tell you is what Don knows and what other physicians know and the other system knows around how we create, I'm going to steal your word, I like it, an algorithm to fund the charity care in our community. Maybe it's a line item that's a community line item, and all parties, both health systems, the insurers, all have accountability to fund based on the volume of charity care you provide. It's a simple linear equation. If you provide 30% of the free care in this community, then you pay 30% of the bill. It's that simple. But I think the only way we get there is we get the right people, the right minds in the room together and have some new thinking, not the parochial thinking that has been in healthcare in this community for a long time. Thank you.
Well, so we'll wrap it up.
Yeah, I'll wrap it up. Just, in terms of what this community needs, we have a very, very strong local board of directors. And our board provides to us the direction that we've always taken. Our mission hasn't changed in a long, long time. What's changed is how do we accomplish that mission. We've been involved in medical education longer than most of us have been in this room. We spend $100 million a year in medical education. We train over 200 residents. We've been involved with medical education because it's very, very important to being on the leading edge of healthcare. The medical school coming to our campus is just, it's the logical next step for that. Most of those, many of those students would come to our campus anyway. what we're going to be able to do is provide that third and fourth year student with a on-campus location that Chapel Hill just simply cannot do anymore. And as we expand healthcare coverage to all these new people, they're going to have physicians. And right now the state can't pay for it any other way. So rather than shut the whole thing down, we're going to take the next step and keep it moving in the right direction. We do not want to end up in a situation where nothing gets done over the next 5-year period. So I think we're making great strides. And again, we take direction from our board. And I didn't get to answer your question, but in terms of community leaders, we have those people on our board. They're local, and we get our direction from them. We have indigent care clinics all over the city. We're in the West Side. We're where people need access, and that's what we've done for more than 60 years.
Okay. Mark Billings, Doug Bradley, Gina Galani, Russ Finn, thank you.
Thank you.
Like to again thank our sponsors of Presbyterian Healthcare, as well as the Harris Conference Center. Tony, thank you for hosting us. You're my sponsor. North Carolina legislative reception will start next